Hi, my name is Jennifer Benjamin. I'm an associate professor in Texas Children's Hospital in academic general pediatrics at Baylor College of Medicine in Houston. And we recently published an article, Reflections from the Pandemic: Is Connectivism the Panacea for Clinicians? In our paper, we explored the need for health professionals to rethink how they learn because of the rapid development with artificial intelligence. Traditionally, learning in healthcare field happens through experience with tried and tested methods called constructivism. And this method of learning worked really well in established areas where we as health professions led as experts. We used the personal experience of one of our authors who learned about masking well before it was common knowledge in the beginning of the pandemic. We recognized the parallel of that personal experience to how we now learn in this new digital age with AI and proposed a new framework for learning called connectivism. Connectivism was first defined by George Siemens, where he describes how we learn by being connected to sources of accurate information. And these sources are also called nodes. So nodes can be people, communities, experts in other fields who are familiar with how AI models work. So with this new approach of learning, knowledge rests in the diversity of opinions, and learning happens by being connected to these nodes of information. And the ability to see connections outside of one's field, for example, going outside of healthcare and learning from other experts within engineering and technology, now becomes a new skill, and it needs to be developed. And this approach of learning also addresses some of the nuances of how we learn when the information is changing very rapidly, as in the field of generative AI. We chose JMIR as our journal for publication, as our article could be published as a preprint while it was undergoing peer review, and also because of the impact factor of this journal. Since the article was a perspectives piece and a new idea, we needed a journal that would consider novel and innovative approaches for learning, and JMIR was a great fit.